Welcome to the Deep Dive. Today we're exploring a truly transformative area, how technology is, well, fundamentally reshaping healthcare. Think about it. Digital stuff has touched every part of our lives, and now it's profoundly changing something as essential as health. Our mission today is to unpack the sheer scale and speed of this transformation. We're talking about the global telehealth software market. We're drawing our insights from Cognitive Market Research's forecast to 2033. So we'll be looking at the hard numbers, trying to figure out where this, digital health revolution is really taking off.
It's fascinating, isn't it? What's really striking is how quickly telehealth moved from being, well, kind of a niche thing to a global phenomenon. And the data, it gives us a very clear picture of just how fast this adoption is happening and, what it means for delivering healthcare worldwide.
Okay, let's start with the big picture then. The global telehealth software market, it was worth just over, $6.1 billion back in 2021?
That's right, $6.1 billion, already a pretty big number.
Yeah, but get this. It's projected to jump to nearly $10.5 billion by 2025.
Mm-hmm.
And then really accelerate to a remarkable $30.6 billion by 2033.
It's quite the leap. If we connect that to the broader landscape, you're looking at nearly a five-fold increase in, just over a decade?
Wow.
And this reflects an impressive compound annual growth rate, the CAGR, of about 14.4% every year.
Right, the CAGR. So that smooths out the bumps, gives us the underlying trend.
Exactly. Think of it as the steady growth engine over time. It shows the real momentum, and it signals a really fundamental, sustained shift. This isn't just, a passing fad.
And this kind of growth, it's definitely going to impact how you or maybe your family access care, moving beyond just the doctor's office to more, digital options.
Yeah.
So where is this huge growth mostly happening right now?
Well, North America has certainly been leading the charge in terms of market size.
Right.
The report shows its market value was around $2.5 billion in 2021, but it's projected to soar to nearly $11.8 billion by 2033. That's with a CAGR of about 13.9%.
Still very strong growth. And within North America, who's driving that? Is it mostly the U.S.?
The United States, yes, naturally contributes the most to that overall value. Projected from about $2.1 billion in 2021 to nearly $9.9 billion by 2033.
Right.
But it's interesting, Canada actually has a slightly higher CAGR, almost 14.9%, and Mexico is also showing strong growth, around 14.1% CAGR. So it suggests, a really widespread embrace of these telehealth solutions, virtual visits, remote monitoring, that sort of thing across the whole continent.
Okay, so North America leads in size.
Yeah.
But you mentioned speed earlier. Which region is really accelerating fastest?
Yes. While North America holds the biggest piece of the pie right now, the Asia-Pacific region, that's where you see the truly remarkable rate of growth. This region shows an overall CAGR of about 15.4%. That's actually the highest among all the regions in the report.
15.4%? Wow.
Yeah, and what's really fascinating there is just the sheer velocity, the speed of it, especially when you think about the huge population involved. India, for instance, shows the highest country CAGR in the entire report, over 16.1%.
16%.
Projecting from roughly $244 million in 2021 to nearly $1.5 billion by 2033.
Incredible.
And China is also a massive contributor, obviously, with about a 15.6% CAGR. We're also seeing really rapid expansion in places like Singapore, that's 15.8% CAGR. And the overall Southeast Asia segment is almost 16% CAGR. This isn't just about making things convenient. It's fundamentally about expanding access, getting care to millions who might have faced significant barriers before.
Absolutely. You can just imagine the impact that kind of growth has, changing how millions get medical advice, moving healthcare way beyond, the traditional clinic walls. Okay, now let's shift focus a bit. What about Europe? Another major player, right?
Definitely. Europe shows solid, significant growth, too. Projected from about $1.4 billion in 2021 to over $6.5 billion by 2033.
Okay.
But if we connect this to the bigger picture, you see, different speeds even within a relatively mature market like Europe. Germany, for example, looks strong. Projected to reach almost $1.4 billion by 2033, and that's with a healthy 14.7% CAGR. However, you look at other countries, say Russia or Luxembourg, and they show slightly lower CAGR, so it gives you a more nuanced view, Adoption rates vary across the continent, maybe reflecting different regulations or how established their healthcare systems already are.
Right, it's not monolithic, and it's not just these major economic areas, is it? The report suggests this is really global.
Oh, absolutely. The reach of telehealth software is truly spreading everywhere. Other regions like South America, the Middle East, Africa, they're also seeing significant acceleration.
So it's reaching pretty much everywhere.
It really is. And this highlights that universal drive for more accessible healthcare.
Hmm.
For instance, down in South America, Argentina has a really robust 15.3% CAGR.
Okay.
Over in the Middle East, the UAE stands out about 15.3% CAGR there too. And in Africa, South Africa is leading with about a 14.5% CAGR. These figures, they really show how this technology is genuinely expanding access, reaching, well, pretty much every corner of the globe, offering new ways to deliver care that go beyond the old models.
So wrapping this up a bit, what does this all mean for us? I mean, these numbers, they paint a really clear, almost undeniable picture, don't they? A phenomenal acceleration in telehealth adoption. And not just in one or two places, but across every single continent. It feels like a truly global shift.
Yeah, absolutely. And, knowledge is most valuable when you understand it and can apply it. This data, it just unequivocally underscores a profound global healthcare transformation. It really does. It's not just, oh, this is more convenient. It's fundamentally about expanding access to care. It's about reimagining how patients engage with healthcare providers. And it's driving significant shifts in infrastructure worldwide. We're seeing a move towards more proactive, accessible digital health models that can serve people in entirely new ways.
So as we look ahead, maybe something for you, the listener, to think about. Beyond the obvious convenience factor, what broader, maybe longer-term impacts might this rapid shift to digital health have? Think about the whole healthcare system infrastructure, workforce training, maybe even patient expectations, and perhaps the pace of medical innovation right there in your own community. Lots to consider.
Welcome to the deep dive. Today, we're jumping straight into telehealth software. It's a really dynamic area, definitely one of the fastest growing in digital health.
Absolutely, moving incredibly fast.
And we're digging into insights from a pretty thorough analysis by Cognitive Market Research. They've really laid out the drivers, the roadblocks, and what's coming next in virtual care.
It's a solid overview.
Yeah. So this deep dive is for you, whether you're maybe a medical professional, a tech person, or honestly just curious about where all this digital health stuff is headed.
There's something for everyone, really.
Okay, so let's get into it. First off, what's really fueling this market growth? What's behind it all?
Well, fundamentally, it's the growing demand for remote healthcare. It sounds simple, but it's huge.
Right.
Think about people in underserved areas, both, urban and rural, or even just follow-up appointments.
Saves the trip.
Exactly. It means convenience, less travel, and frankly, just better access to care. It helps patients and providers.
And I guess technology is the big enabler here, right? I mean, that progress seems unstoppable.
Oh, definitely. Technology is pivotal. We're seeing really cool innovations.
Like what? What's standing out?
Things like mobile health apps becoming much more sophisticated, AI-powered diagnostics, tools that can help analyze scans, for instance, and crucially, cloud-based EHRs, that's electronic health records. They allow for sort of seamless data sharing.
Secure sharing, hopefully.
Well, that's a key point we'll get to. But yeah, secure sharing is the goal. Plus, the video conferencing itself is just way better now. Real-time monitoring, high-quality consults.
Okay, so demand and tech,
Yeah.
anything else pushing it forward, like policy?
You got it.
Yeah.
Supportive government policies, expanding insurance coverage. These are really accelerating adoption.
So?
Well, things like favorable regulations, specific funding initiatives, and clearer reimbursement rules. They basically make it more attractive, financially speaking, for hospitals and clinics to actually use telehealth.
Right, remove some of the financial barriers. Makes sense. But, like you hinted, it can't all be smooth sailing. What are the speed bumps? What's slowing things down?
Yeah, there are definitely challenges. A major one is data privacy and cybersecurity. It's a huge concern.
I bet. We're talking very sensitive information here.
Exactly. Patient data online.
Hmm.
The risk of breaches is real. And then there's compliance with rules like HIPAA. That's the big U.S. law protecting health data. Non-compliance is a serious barrier to trust and adoption.
Yeah, absolutely critical. What else? Is it just security?
No, another big factor is infrastructure. Limited digital infrastructure, poor internet connectivity.
Ah, the digital divide.
Precisely.
Mm.
Especially in remote areas or developing regions. If the connection isn't reliable, the whole experience falls apart. It affects efficiency, reliability, everything.
So it's not equally accessible everywhere, even with the tech.
Not yet. And then there's, well, resistance to the technology itself.
From who? Patients, doctors.
Both, sometimes. Some healthcare professionals might be hesitant, maybe unsure about the clinical side of it, and some patients, particularly older ones, might just lack familiarity or have concerns about, how effective a virtual visit really is compared to seeing someone face to face.
Okay, so real hurdles there. Privacy, infrastructure, adoption resistance. Despite all that, where is this heading? What are the sort of exciting emerging trends shaping the future?
What's really fascinating, I think, is how AI is being integrated more deeply.
Beyond just the diagnostics you mentioned.
Yeah, much deeper. AI and predictive analytics in telehealth platforms. Think about more proactive care systems flagging potential issues before they become serious.
Predicting needs.
Exactly. Automating things like patient triage, too,
Hmm.
and really supporting chronic disease management in a more continuous way.
That sounds like a significant shift. Anything else catching your eye?
Definitely the growth in virtual behavioral and mental health services is huge.
Telepsychiatry, remote counseling, that sort of thing.
Yes, those platforms are really gaining traction. And a big reason is they help break down stigma. It's often easier for people to seek help remotely. Plus, it just broadens access dramatically.
Makes sense. Easier access, less stigma. And is there a bigger picture trend tying this together?
I think so. If you zoom out, it's the emergence of these hybrid care models.
Combining in-person and virtual.
Exactly. It's not an either-or situation anymore. It's about blending them, maybe an initial visit in person, follow-ups online.
Flexibility.
Right. It enhances patient engagement, offers that flexibility, and it's really cementing telehealth software as, a permanent part of the healthcare landscape, not just a temporary fix. It's becoming foundational.
So at quite a journey, we've just taken a deep dive, drawing on that cognitive market research analysis, looking at the forces, while driving telehealth, holding it back, and really shaping its future.
And thinking about all that, it really leads to an important question for you, the listener. As these hybrid models become more common and AI gets woven deeper into how you get care, how do you see healthcare actually changing in your own life? What new possibilities open up?
Yeah.
But also, what are the challenges? How do you balance all this new convenience with, the essential need for security and truly comprehensive care?
That's definitely something to think about. A provocative thought to mull over indeed. Thanks for joining us on this deep dive. Keep exploring.